Hello, my name is Samantha Leskowitz, and I've decided to do my informative speech on coronary heart disease. The reason I chose this topic was due to the way that this disease has not only affected my family, but many other families across the world. Coronary artery disease truly is taking over the world. Coronary artery disease, also known as coronary heart disease, has really affected my life in many ways. About 12 years ago, while I was still in elementary school, I'd received a phone call that had changed my life forever. I'd gotten called down to the main office and had absolutely no idea why. I had found out that my mom had called into the office to notify them that she had to immediately pick up my brother Chris and I. And at the time, I was so nervous because my mom wouldn't tell us what was going on the whole way home. She had gathered us around the kitchen table and told us that my dad had been rushed to the hospital. I had absolutely no idea what was wrong, and we all broke out into tears, not knowing what to do or if my dad was even going to survive. We found out that he had a severe heart attack with one of his main arteries being almost completely blocked, and ever since then, coronary artery disease is something that I take very seriously. I work in assisted living, and I constantly remind my patients that their health is something to take care of and to not take lightly. However, I have always wondered what really causes it and how you can possibly prevent saving your own life. At the time, I had absolutely no idea what a heart attack even was or what coronary artery disease truly is. All I knew that it was something that wasn't good and my dad had a chance of dying. I knew that it had involved your heart or arteries being blocked from some sort of bad substance, but I didn't really know why or where it even came from. I knew that he was in a lot of pain and it wasn't healthy, but all I truly cared about was whether my dad was going to make it home safe and that he would be okay. While I completed research, I began to get a stronger understanding of what coronary artery disease is, how he got it, and ways in which he can prevent further problems such as a heart attack. However, since then, my dad has had 2 major heart attacks and 7 stents placed in his heart. My dad is a little overweight, but he stays quite healthy on a daily basis by running restaurants. It just didn't quite make sense to me on how people can even acquire it. But when I began to figure out what to research, I became very interested because my dad had been a victim of heart disease, and I know how much it has truly affected our family. Coronary artery disease is the leading cause of death worldwide, with many different causes and ways to prevent it. Researchers have discovered that CAD has been the leading cause of death worldwide, with more than 15 million Americans diagnosed with CAD. Coronary artery disease begins with angina, which is also known as chest pains, which can then lead to a myocardial infarction, also known as a heart attack. In the United States, cardiovascular disease deaths nearly outnumber deaths from all other causes combined. During 2015, the American Heart Association noted that about 7 million deaths occur globally each year due to coronary artery disease. However, with the number of treatments and drugs today, the number of deaths from cardiovascular disease has noticeably declined. Coronary artery disease has many main causes which relate to coronary arteries on the surface of the heart. Coronary heart disease is a disease in which a waxy substance called plaque builds up inside the coronary arteries. These arteries supply oxygen-rich blood to your heart muscle, and when the plaque builds up inside the arteries, this condition is then known as atherosclerosis. The buildup of plaque occurs over many years, and over time the plaque will begin to harden or even rupture. Hardened plaque narrows the coronary arteries and reduces the flow of oxygen-rich blood to the heart. If the plaque ruptures, a blood clot can form on its surface, and over time, ruptured plaque then begins to harden and narrows the coronary arteries. Coronary artery disease begins when the arteries of the heart become partially blocked or clogged up. A heart attack will then begin when the flow of blood is cut off due to the blockage. Many of the causes of coronary artery disease relate to a person's well-being and how one takes care of thyself. Poor nutrition plays a huge part in the development of coronary artery disease. The average woman needs to consume about 2,000 calories a day to maintain her weight, while a man needs to consume about 2,500 calories to maintain his weight. However, many people consume way more calories than they need to. People also tend to eat more accessible and cheaper foods due to our environment always being on the move. However, those fast foods have way more fats and cholesterol as compared to fruits, vegetables, and other healthy fibers. An unhealthy diet that is high in saturated, trans fat, cholesterol, sodium, and sugar will almost definitely raise your risk for heart disease. These fatty substances attract fibrous tissue, blood components, and calcium to harden into the artery-clogging plaques. Nicotine is another very important part when it comes to coronary artery disease. Nicotine builds up in the plaques in the arteries, which therefore decreases the blood flow to and from your heart. If you reduce or cut back smoking, you will notice changes in your health in less than 2 weeks. Within those 2 weeks, your circulation will begin to improve, and within 1 year, the risk for coronary artery disease will decrease by half. And after 15 years, you will be compared to a non-smoker. Meanwhile, smoking is a terrible habit as well as a large contributing factor when it comes to coronary heart disease. According to the Centers for Disease Control and Prevention, they have found that cigarette smoking greatly contributes to blood vessel and heart issues. Smoking can lead to tighter and more damaged blood vessels, which then leads to unhealthy cholesterol levels, as well as rising blood pressure levels. Smoking also drastically limits how much oxygen is able to get to the body's tissues, and this will then begin to damage almost every organ of the body. Studies have shown that smokers are 50% more likely to die of a sudden heart attack rather than non-smokers. The American Heart Association estimated that about 46,000 non-smokers each year die from cardiovascular disease from other people's secondhand smoke each year. Smoking drastically increases the risk for heart disease over time as well as a chance from passing away from it. Throughout all the research, exercise seems to be the best way to prevent any cardiovascular disease or heart disease. Exercising regularly increases blood flow and contraction of the heart, allowing it to pump more efficiently and reducing the workload. The American Heart Association recommends for all adults to try and do at least 30 minutes of physical activity at least 5 days a week. Physical activity can lower your risk for diabetes as well as raising your HDL cholesterol levels. HDL is the good cholesterol that helps prevent CHD. It is also very important to speak with your doctor before you start a new exercise plan. Be sure to ask him or her how much and what kinds of physical activity are right for you. The more active you are, the more you'll benefit overall. According to Dr. Osner, exercise is so powerful it even helps people with existing heart disease, including those who have already had a heart attack. Exercise truly is the best medicine, and by doing so, you're more likely to feel better, look better, lose weight, and gain health. The next best prevention alongside exercise is to maintain healthy eating habits. This includes eating more fruits and veggies rather than fats and cholesterols. Keeping up with good eating habits can reduce the risk of heart disease greatly. This includes decreasing the risk factors associated by diet, including diabetes, obesity, metabolic syndrome, dyslipidemia, as well as hypertension. Due to the high levels of antioxidants and phytochemicals in fruits and vegetables, researchers now have a clear understanding of how these substances help prevent coronary heart disease. Patients suffering from this disease should develop better eating habits and create more time for physical activity. It is known that due to the hectic pace recorded in the world, people tend to lead a sedentary lifestyle, which causes this type of disease. Maintaining a healthy diet is the most important part of a healthy lifestyle. Overall, coronary artery disease is something that can be prevented through a healthy, active lifestyle, which includes a maintained diet. Since more people are adopting to a healthy lifestyle habits today, they're greatly reducing their risk factors such as high cholesterol and blood pressure. By eating right, exercising daily, you will not only help yourself feel better, but you are helping your overall health. Thank you.